Hello, we are live. We are live. I'm Dr. Frita, and welcome to Medical Monday, where you get all of the hottest health headlines in the news. And I'm very excited because today we are streaming not only on YouTube, we're also streaming on Facebook and on Instagram. So hello to everyone who's here in the live chat, and hello to those of you who are joining us on the replay crew as well. We have a lot of hot health headlines to talk about as usual. Let's start off with my favorite game, Myth versus Fact, where we'll talk about how to outsmart pollen. I'll give you some myth versus fact statements. We'll play a little game, and then I'll talk to you about how to deal with these enormously high pollen counts that are going around. And then I'll give you your weekly dose, where I'll give you a fresh take on medicine in the news that you just can't get anywhere else. We'll start off talking about Real Housewives of Atlanta, not just because I'm a fan, yes, I am, but also because one of their newbies, Kelly Farrell, who is quite the fierce businesswoman and mother, well, she shared that 3 of her daughters have been diagnosed with osteogenesis imperfecta, OI, also known as brittle bone disease. And so we'll talk about that. And we'll also talk about why it is that parents of children with osteogenesis imperfecta often have CPS, Child Protective Services, called on them. We'll delve into that. And then we'll talk about TD Jakes. Now, you know, right here on Medical Monday, back in November 2024, when TD Jakes had that medical incident, we covered it. We talked about all of the possibilities, what it could be. And now he has shared what it actually was. He had a massive heart attack, but he didn't have chest pain. So we'll cover some of the atypical or unusual symptoms of a heart attack you should never ignore. And then we'll talk about Damon Wayans, who is looking great, feeling great. And he shared that he has a diagnosis of diabetes, and he's doing some unconventional treatments, mainly lifestyle, managing it naturally in a lot of ways. And so we'll touch on diabetes and some ways to manage it naturally. And then I'll give you your 5-minute health check, or I'll just give you updates every single week on certain food recalls, different updates with infectious diseases. I'll just give you a quick run through, a 5-minute health check. And of course, we are interacting live. And so I'll be talking to you. You'll be talking to me. We'll have a little bit of a live Q&A, but for the main live Q&A that's reserved for my members here on YouTube, we're having that today, members only, where it will be only questions. You can ask me questions back and forth. You can come join us on stage. But you know what? Let's go ahead and get started. It's Medical Monday. I'm Dr. Frita. We're about to have a good conversation. All right, we are live. I'm Dr. Frita. Hello to everyone, my faithful YouTube crew, and welcome to my Facebook members watching live, my Instagram followers watching live. Please put in the chat where you're watching us from. From where are you watching? What city? What state? We want to know who all's checking out these hot health headlines. Meanwhile, y'all know I don't do this alone. I'd like to welcome to the stage my practice manager and my co-host, Miss Shador. Come on to the stage, Shador.
Hey, Dr. Frita. Hey, everyone.
Hey, Shador, how are you doing?
Doing pretty good. How about yourself?
I'm good. I'm good. Did you have a good weekend?
I did. How about yourself?
I had a good. We had more basketball, but really, last week was really an exciting week because I was on News Nation, the national news show News Nation, and I was talking about Mookie Betts of the Dodgers because he had this mysterious illness where he lost up to like almost 25 pounds. He was vomiting. Well, so I talked about all the possibilities of what his illness could have been. And even more excitingly, he played on Thursday. He is on the mend. So check that out. I have posted that on all social media platforms. And of course, on my TV appearances, we'll have that here. So it's me on News Nation talking about Mookie Betts. And then I was on Good Day Atlanta, Shador. I was back on there on this past Saturday doing a segment, Health Headlines with Dr. Frita. So I will be posting that as well. And so make sure that you're following me on all social media platforms because I'll let you know as I find out when I'll be doing these fun news shows and sharing information. Well, Shador, I hope you and your family did okay in the pollen because the pollen counts were up in the sky. Did you know that?
Yeah, I saw some numbers around this way.
Yes.
It's not just a sign in my family. So when it's up, we know.
When it's up, then it's up. It is up, then it's stuck. And so mainly just 2 of my kids, 2 out of 3, react to the allergies and the high pollen counts, and they even get shots in order to try to manage the pollen counts. Meanwhile, the youngest daughter, Avery, and I, we do fine. We do just fine. Shador, who was the first person in the chat today?
First person today was our member, Miss Kim.
Hey, Miss Kim, and thank you for being a member, Kim. I'll see you later on today where we have our members only exclusive live Q&A. So please have your questions ready. And for those of you who are new to us here on the Dr. Frita YouTube channel and IG and Facebook, I am Dr. Frita. I'm an MD, a medical doctor. I've had multiple board certifications. I am certified in nephrology, meaning I'm a board certified kidney doctor and high blood pressure doctor. I also have received board certifications in internal medicine, pediatrics, and most recently, I became board certified in obesity medicine. And so I like to learn a lot about a lot. And more importantly, I love to share it. And so if you join our membership at the highest tier here on YouTube, then you'll get a chance to have monthly live Q&As where you can pick my brain and I will just sit here and go on and on and on and on about medical information. All right. Well, let's get started then with my favorite little game, Shador, myth versus fact. And today we're talking about how to outsmart pollen, because guess what? In Atlanta, we actually broke more records on pollen counts. And so people with seasonal allergies or hay fever are not having a lot of fun. But we'll talk about what to do. But let's go ahead and get started, Shador. What is our first myth versus fact statement?
Pine pollen is the main reason for seasonal allergies.
Put an M1 if that's a myth. Put an F1 if that's a fact. That pine pollen, is that the main reason for seasonal allergies? M1 if it's a myth, F1 if it's a fact. All right, myth versus fact statement number 2.
Pollen counts are highest when the weather is dry and windy.
All right, for this one, put an M2 if you think this is a myth, an F2 if you think this is a fact, that the pollen counts are highest when it's dry and windy. Do. Pencils down, pencils down. All right, Shador, do we have any takers? Anyone play my little game, myth versus fact?
Absolutely. So we'll go back to our first statement. Pine pollen is the main reason for our seasonal allergies.
Okay, what say you folks in the chat?
So we do have mixed review here.
Instagram.
Mixed review.
Oh, good.
Miss Rosalind, we'll go with our facts. Miss Rosalind, our member, hey.
Hi, Miss Rosalind. Thank you for being a member.
She's going with a fact here, Dr. Frita.
She said, so she thinks that the pine pollen is the number one cause of people having the allergic reaction. Okay.
Agreeing with her is David.
David. Everybody knows what this pine pollen looks like. All right, David, welcome. I have an uncle, David.
Blackjack
says that it's a fact, that it's that pine pollen that gets everybody, that it's the number one, that it's the biggest irritant of the pollen.
Switching over to our myths. Miss Paula says a myth.
Ooh, Miss Paula says this pollen statement is a myth. So she does not think that the pine is the number one cause of allergic reactions in this pollen season. All right, Miss Paula.
Cookie also agrees a myth.
Hey, Cookie. So you think it's a myth as well. Paula, Cookie. And
Laverne says a myth.
Paula, Cookie, and Laverne say it's a myth. Y'all don't think pine is the number one cause of everybody having these allergic reactions? Well, the answer is you are correct. It's a myth. Paula, Cookie, and Laverne. It's a myth. Now, let me tell you. Now, pine pollen definitely can cause allergic reactions, okay? It definitely can. But here's the thing. Other tree pollens that tend to even cause more allergic reaction include the sycamore trees, oaks, birch trees. The reason everyone recognizes pine pollen is that the pine pollen is large and it's that bright yellow color. And so we're able to see the pine pollen on our cars, on our clothes, on our pets when they go outside, on our driveways. So the pine pollen happens to be the most visible. And yes, it definitely can cause issues, but it's not the most allergen allergy provoking one. Okay. There are other things, oaks, sycamores, birches, even sweet gum trees, all kinds of trees other than just pine. So I do want to play a clip, but then I want you all to please put in the chat, what are some ways to outsmart pollen? Okay. What are some ways to avoid having seasonal allergy reactions? Okay. And so we'll talk about that. We'll do this clip. We'll get into the discussion.
Cars, sidewalks, parking lots, pools, just about everything is covered in it. Our annual pollen explosion is well underway across North Georgia.
We're still getting the same pollen that we got last year, the year before that. It's the same one, the trees are still out there. We're still seeing our sycamores, our birch. The pine pollen is an interesting thing because I think that's when we associate most of our allergen symptoms, but it just happens to actually come at the same time that the, sycamore and birch where we're actually getting the most symptoms from.
Atlanta's tagline, City in the Forest, comes with a cost. Each late winter and early spring, trees that famously dot our landscape release pollen as they bud and produce new leaves. However, the pollen that you see isn't necessarily the pollen that makes you sneeze.
A lot of times patients start feeling symptoms when they actually see the pine pollen. And so they associate it with the pine being their actual most, causing the symptoms. But in reality, pine just happens to come at the same time as, your hardwoods. So like sycamore, oak, and birch are usually.
Dr. Wong also says that exposure and duration of exposure to different pollen types vary greatly across people. This is one of the reasons why people are impacted differently during pollen prime time.
No, it doesn't affect me.
It is a big deal. I can tell when the pollen's in the air. Still love to go out and look at all the flowering trees and bushes. So
I feel like it hasn't been that much this year for me personally, because usually my car is covered in it, but I haven't been dealing with it too much.
All right. Thank you for everyone who participated in that first myth versus fact question. Yeah, that really is interesting. So the pine pollen is the big one, is the bright yellow one, and it's the one we see. But the oaks, the sycamores, the birches, these other ones that aren't quite as visible are really doing the dirty work, the nasty work of making us sick. All right. And how about myth versus fact question number 2, Shador?
Yes, ma'am. We'll bring this back up here. Pollen counts are highest when the weather is dry and windy. So we'll jump over to our Instagram viewers here. Dr. Frita, they chimed in on this one.
Hey, Instagram. Listen, Instagram, I was in my feelings this weekend. I did an Instagram live. I keep having incidents at these AAU basketball games. I need to look to self. But so y'all check that out on Instagram. Thank y'all for joining us.
Miss Deborah says this one is a fact.
Wait a minute. She says the fact that when it's dry and windy, that's when the pollen counts are high. Okay, Miss Deborah, let's see what you got.
Miss Lucy agrees with Miss Deborah.
You said Lucy?
Yes.
Oh, my grandma's name was Lucille. All right, so you think it's a fact when it's dry and windy.
Bob and Celie are both saying it's a myth.
It's a myth. So you think when it's dry and it's windy and such a nice little cool breeze that the pollen count is not necessarily the highest, okay?
Mm-hmm. And over here back on YouTube, Miss Kim
says a fact that when it's dry and windy, that's when you're going to have the highest pollen counts, okay?
Mm-hmm. And new to YouTube is Violet. She says a fact.
Welcome, Violet. Oh, and your name is Violet because we know plants also have pollen. Plants, trees, grasses, ragweed. So you think it's a fact when it's dry and when it's windy, that's when the pollen counts are going to be the highest.
Mm-hmm. And one more for the myth takers. We have Shar.
Okay, Char's not having it. She says that is a myth. Mm-hmm. All right. So the pollen counts are highest when it is dry and windy. This is a fact. It is a fact. And for anyone who's in this chat who has seasonal allergies, so you know what the pollen count is like and what your symptoms are like when it's sunny and then when it's dry and clear and beautiful. But let me ask you this. What are your symptoms like right after a heavy rain? A little less after the rain, right? And that's because, yes, it's true. When it's dry, when it's windy, that's when the pollen tends to be carried in the sky. It's up, it's about, and we have the highest pollen count. So let's talk about what is a pollen count. Pollen count refers to the number of grains of pollen per cubic meter of air, right? And so it's considered to be a low pollen count when it's like low, like less than 50, a high pollen count when it's higher than 1,000. And back in 2000, back in 2012, we had some record-breaking pollen numbers here in the Atlanta area of over 9,000. But just this past Saturday, Shador, do you know we broke another record and the pollen count was over 14,800? That means that there were 14,800 grains per cubic meter of air. And you can imagine when the air is dry, when it's sunny, that pollen's able to float about more and be up and about, as opposed to being washed down wet and kind of sticking to the ground. Okay. So that was a true statement. The pollen count is highest when the weather is dry and when it's windy. And we know that pollen can really affect people who have allergic rhinitis, also called seasonal allergies. It can cause symptoms of red eyes. It can cause itchy throat. It can cause headaches. It can cause a runny nose. It can cause all kinds of misery, quite frankly. And, so the higher that pollen count, the more affected people with allergic rhinitis or hay fever tend to be. So I asked the question, I want to know if anyone participated in this answer. What are some ways that we can outsmart pollen? Let's talk about that. Let's talk about some action steps.
Yeah, absolutely. So Blackjack, excuse me, says wear face masking or face covering.
That's true. Wearing face masks, throwing on a surgical mask can keep you from inhaling as many pollen particles as you might have inhaled without it. So that's a good one, Blackjack.
Aline says using an air purifier.
Yes, using an air purifier, having HEPA filters in your home. That's a good one. Also, even just with your air conditioning vents, making sure you change or clean those filters frequently. Very good. That's another way to outsmart pollen.
Speaking of changing, Miss Laverne, hey, says change clothes when coming indoors.
Word up, Miss Laverne. That's a good one. People don't think about it. Okay, so if you're out and the pollen count is high and you've been out playing, walking the dog, out with T-ball with your kid, and you come into the house, then you're going to have all of that pollen on your clothes, on your shirt, your pants, your dress, your sneakers. It's going to be everywhere. So yes, if you take those pollen-filled clothes off, put them to the side, wash them, and put on fresh clothes without pollen, then that will cut down your pollen exposure and it can decrease your seasonal allergy symptoms. That's a good one. Anybody else?
Yeah, Miss Paula chimed in with a few. Keep windows closed. See
Good.
And take your allergy medicine.
Okay, so yes, keeping your windows closed, not only in your home, but also in your car. Close those windows, turn the air conditioning on. Okay, and what else?
See ENT.
Okay, so see an ear, nose, and throat doctor, or see, and we have allergy specialists now, allergy, asthma specialist. Okay, so seeing an allergist, really, seeing a board certified allergist will be helpful. And then taking medications when indicated. And so there are different medications. Some things are just over-the-counter remedies, not necessarily medicines, like using a nasal saline wash. And what that will do, it'll get the pollen out of your nose, because you can come inside all day, but if you've already been breathing in all of the sycamore and birch and oak tree pollen, it's stuck inside of your nostrils. So if you get nasal saline, it's just salt water. It's a pretty inexpensive price over the counter at your local pharmacy. It'll come with the nozzle. You take that nasal saline, you lean over the sink, and you put the nasal saline up your nose, okay? And you aim toward the outside corner of the same eye as the nostril you're spraying, okay? So if you put it up your right nostril, you aim toward the outside corner of your right eye, but the nozzle is inside your nostril. And you literally just stand over the sink and you flush and you flush and you flush. And that helps to get rid of pollen. And you definitely consult with your doctor, but your doctor may recommend that you do some of the over-the-counter nasal steroids like Flonase, for example, and that can help to decrease inflammation that may occur from being irritated by pollen. It's important to do the nasal saline first, because what you don't want to do is put medicine on top of pollen and on top of mucus. Okay, so use the nasal saline first. And then sometimes they may have you to do some antihistamine medications like Zyrtec, like Allegra. So absolutely, those are great, Polly. I think you might have taken this on in. Anyone else have any?
Yes, Aline, she said avoid mowing your lawn.
Okay, so just avoidance, right? So avoid mowing your lawns, especially during times where it's dry, times when it's, windy, times when the pollen count is going to be high. So avoid doing that. Avoid having picnics outside in high pollen if you know that you're someone who is easily irritated. Just avoid going outside when you can. And once you're inside, close those windows. Yes. Anyone else?
No, that's it, Dr. Frita.
Okay, that's good. Okay, some other things. taking a shower before you go to bed. When the pollen is out there, it can stick on your eyelashes, right? On your hair. And so if you get a lot of pollen that way, wash your hair, wash your face, wash your body. A lot of times with children, especially, they're out, they're playing, they have pollen. And if they don't bathe or shower before they go to bed and they have pollen on their eyelashes, that pollen is irritating their eyes all night long, and they'll wake up with a conjunctivitis, right? An inflammation in their eyes, red eyes. So taking a shower, washing your face, getting rid of the pollen before you go to bed. Also, those of you with pets, especially if you have pets with dark hair, they go outside and they come in looking bright and yellow and pollen filled. So take something nice and wet and wipe your pets off, wipe your pets' paws off, so they're not coming in here tracking pollen all up and through your home. Some other things that you can do, if you know that you have to be outside, I say avoid, but if you have to go outside and you know that there's a high pollen count, go ahead and take some of those medicines preemptively, like the Zyrtec, like the Allegra. Consult with your doctor, of course. And so you mentioned the changing of the clothes already. I think those are most of the things. And of course, just pay attention to the news and watch the pollen counts. All right. So these are some ways to outsmart pollen. Make sure you're looking at your local pollen counts. And again, consult with your doctors. And yes, I think Ms. Paula had a great suggestion, seeing a physician, like an allergist, if you're someone who has high allergies that really you haven't been able to control well at home. Like in my home, for example, 2 of my kids have to be on shots to desensitize themselves from the allergens, or else they look like somebody took them out and knocked them in the eyes. They get red eyes, they're snorting, they can't learn, they can't concentrate when they're having these heavy allergic reactions. All right, thank y'all for participating in my little game. Shador, has anyone put in the chat by chance where they're watching from? If so, if you see them later on, Shador, please just shout them out.
All right. Yeah, absolutely. So I remember Ms. Rosalind is watching from St. Pete, Florida.
St. Pete what? St. Petersburg, Florida?
Yes, ma'am. Yes, ma'am.
You, Miss Rosalind, I'm from St. Petersburg, Florida. Y'all, I lived in St. Petersburg from first grade through high school. My parents still live there. I graduated from St. Pete High, home of the Green Devils. Yes. So, all right, Miss Rosalind, from my hometown, St. Petersburg, Florida. Wonderful.
Does the name Frita sound familiar to you? Frita says, hi, cuz, watching from Facebook.
Oh, yeah. Thank you for joining, cuz. Wonderful. Good to have you. Look, spread it to our other family members. They need some health updates. You know how they need to be on here too. Thank you for joining us this morning.
Your uncle will be 97 years old. Your Uncle Charlie.
Who's going? Wait, Uncle Charlie's on here?
He's 97. So I don't know if he's watching with Fernita or not, but he's doing okay.
Tell him to come on and say hi, and tell him Ned's daughter is on here. Oh, I hope he's watching. Let me tell you, my Uncle Charlie is so cool. He's a retired educator. He has so much good sense and a great sense of humor. He likes picking on people too, but doggone. All right. Y'all, thank y'all for watching. How cool is that? All right. Good. All right. So we'll move on. And if you catch anybody else who shares where they're watching from, then share as we go, please. But now let's get into the weekly dose. This is where I give you a fresh take on the health headlines you just can't get anywhere else. Y'all, listen to me. Now, you already know, it's no secret that I enjoy Real Housewives of Atlanta, and I perk up when the ladies use this platform to educate about medical information. And a couple episodes ago, one of the new housewives, Kelly Farrell, who is an entrepreneur, she's the owner of Nana's Chicken and Waffles here in the Atlanta area, like kind of on the south side. She's the mother of 4 daughters and very fashionable, wonderful young lady. So she seems, I'm liking her so far. Well, she had an event to raise money and to raise awareness for Osteogenesis Imperfecta, or brittle bone disease. Put a 1 in the chat if you've ever heard of brittle bone disease. And Shador, let's go ahead and play this clip, because I actually did a short form content, real short. I have it on all social media platforms. So wherever you're watching from, you can watch the full short after this live. Housewives of Atlanta's Kelly Farrell shared that 3 of her daughters have been diagnosed with osteogenesis imperfecta. I'm Dr. Frita, and here are 7 things to know about osteogenesis imperfecta, including why Child Protective Services is often called on the parents of children with this diagnosis. 1, osteogenesis imperfecta, or OI, is a genetic disorder that causes bones to be thin and brittle and to break very easily with little or no force. It is caused by a mutation or a change in a gene that is responsible for making a type of collagen. And proper collagen is necessary for healthy bones as well as for healthy skin, teeth, muscles, tendons. 2, signs and symptoms may include brittle bones with multiple fractures, blue or gray sclera, and your sclera are the whites of your eyes, small stature, triangular face, brittle or discolored teeth, curved spine, bone pain, muscle pain, loose joints, easy bruising. 3. Okay. All right. So to watch that full short, it's on all social media platforms, and you'll see, like right here on YouTube, if you put Dr. Frita OI or Osteogenesis Imperfecta, you'll be able to see it. But yes, I also have it as a reel on IG, and also have it on short form content as a reel on Facebook and LinkedIn. Also, I have it there too, and TikTok is there too. All right. So I want you to put a 1 in the chat if you've ever heard of osteogenesis imperfecta or brittle bone disease before, even if your first time hearing it was on RHOA, Real Housewives of Atlanta. And so let's just talk about it. So I just shared that it is a genetic disorder, and the people who get it have brittle bones, which is why it's called brittle bone disease as well. And so, yes, they can have multiple fractures. They're even with no force, okay, or very little force, okay. They can lightly bump into a wall and have a broken bone, okay. So that's an issue. They can have easy bruising. They can have malformed teeth. There are actually 19 different types of osteogenesis imperfecta. But when it comes to the most common type, thankfully, the most common type is the one that has the least symptoms. Okay, that's the one that has minimal symptoms. It also has a normal life expectancy. And so, just playing an odds game. And of course, I don't know Kelly Farrell. I don't know anything about her chart or her children, but I'm just going by numbers. It would be most likely that they had the most common type, which I would hope so, because that would give them normal life expectancy and minimal symptoms. Okay, so of the most common types, so there are different ways it can be inherited. It can be inherited if one or both parents are carriers of a gene, and the defect in the gene is that it doesn't allow you to produce normal collagen, okay, a normal type of collagen. And we need collagen in order to have healthy bones, as well as to have healthy skin, teeth, muscles, tendons. And so you can imagine, depending on what type of osteogenesis imperfecta or brittle bone disease one has, then they might have the brittle bones, of course, but they might have the poor teeth because of the collagen. They might have issues with their skin and the easy bruising because of the defect in the collagen. They might have loose joints or joint pains or muscle pains because, again, we need collagen that is normal and healthy in order to have, completely normal muscles and joints. And so, again, depending on the type of osteogenesis imperfecta a person has, the symptoms will vary. Now, how can someone inherit osteogenesis imperfecta? Well, the most common types have an autosomal dominant inheritance, meaning that you only need one gene in order to have the diagnosis. Okay. So it's different from things like sickle cell. With sickle cell, if you only have one sickle cell gene, then you're a carrier and you typically don't have symptoms. But if you have two sickle cell genes, because it's autosomal recessive, then you'll have sickle cell disease. But for most of the osteogenesis imperfecta, the most common types, then it's autosomal dominant, meaning it just takes one gene and you have the illness. And if you do have the genetic disorder, osteogenesis imperfecta, then with each pregnancy, that child has a 50% chance of having the brittle bone disease. Okay. And we know that in the case of Kelly, 3 of her 4 daughters have osteogenesis imperfecta. So one of the things that Kelly shared was that she actually had Child Protective Services called on her when her second daughter, the first one who ended up having the diagnosis, was taken to the hospital, because also with the bones, the long bones, like the thigh bone or the femur, sometimes there's a curvature or a bit of a deformity. And so Kelly said she noticed that something just wasn't quite right with her baby. She took her baby in and they ended up questioning her and holding her because they had to rule out, like, was she actually physically abusing her child? And so that was a question I had for the chat, Shador, and also everyone in the replay crew. Does anyone know why it is that it's pretty often that parents of children with osteogenesis imperfecta, well, they'll have CPS or Child Protective Services called on them? Did anyone participate and answer that?
no one answered that question directly, but you did also ask if anyone heard of the disease before.
Okay.
So Anton shared, I have the disease and my son also has it.
So Anton has it. Hi, Anton. I hope you're doing well. If you have the one that's most common, that means that the symptoms will be minimal, but yes, it could still affect your bones, teeth, things of that nature. It could cause a curved spine. In some people, it can cause a barrel-shaped chest. And you have it and your son has it. I mentioned that the most common forms have that autosomal dominant inheritance. Autosomal dominant inheritance, meaning that if a parent has it, so you, the parent, Anton, then with each child you have, there's a 50% chance, almost a flip of the coin, that your child will have it. So I definitely hope that you take good care of yourself and that you have good care for your son, because again, definitely can have a good, healthy life, normal life expectancy, all of those things, and some treatments. And you may already be familiar. Definitely you want to have a healthy diet, consult with your doctor, but diets that are rich in calcium, rich in vitamin D to promote bone health. For some people, Anton, they take a class of medicines called bisphosphonates. These are the same medicines that are oftentimes taken for people who have osteoporosis or kind of thinning bones, just to help support bone growth. And of course, exercise, avoiding smoking. Look, cigarettes just get on my nerves. Okay. They're on the list of what not to do for about everything. But thank you so much for sharing, Anton. I pray that you and your son do well. Yeah. And it's actually rare. Only about 1 in 20,000 people have osteogenesis imperfecta. So you're in rare air. Okay.
Don has heard of it. And Don also said broken bones often related to child with broken bones. A diagnosis to explain the bones. That's why child protective services would be called.
You're dead on, Don. You're dead on it. So, okay. So y'all know that for my residency, I did a combined residency in internal medicine and pediatrics. And so, of course, when I did pediatrics, we had to be trained to, even when kids come for just well child visits, or if they have a broken bone and their parent says, oh, they fell off the bed, or, oh, they fell, we always have to be aware and be watching for signs of potential child abuse. And one of the things that we're taught is that for children who have multiple fractures at different stages of healing, that could be a sign of child abuse. Also, of course, children with bruises all over their bodies, different stages, that could be a sign of child abuse. Okay, because you can imagine, a parent will come in and a child will have an arm fracture and they'll say, oh, he fell off his bike. But there are different mechanisms on how a fracture looks when it came from a clean fall, like from a tree, from a bike, from some type of a playground toy, versus if a parent has yanked you or twisted your arm. So we're trained to pick those things up. But very importantly, when we're suspicious, we'll do a skeletal survey. We'll do an x-ray of a child's body. And if we see that there are multiple fractures at different stages, we'll know that there's a likelihood that child has been beaten and abused, and just at different times, there are different fractures. And so we will call Child Protective Services on you very quickly. So here's the issue. When a child has osteogenesis imperfecta with these, thin bones, brittle bones, children with OI also have multiple fractures at different stages of healing. Children with OI have, abnormal collagen production affecting their skin. And so they're easy bruisers. So they'll have lots of bruises. And so they have those same signs that we're taught are consistent with child abuse. And so when you see a child with those things, you call Child Protective Services. But one of the things that Kelly shared, and this was her saving grace, there is a physical exam. There's a sign on a physical exam of a child with osteogenesis imperfecta. That's a telltale sign. And that's having blue sclera or gray sclera. So the whites of your eyes, how they're supposed to be white, they're literally blue or gray in children with OI. And in her case, the doctor saw that her baby had blue sclera, and she said, the whites of this child's eyes are blue. This baby has OI. And then eventually Kelly was released instead of being accused of abusing her children. And so, I just pray she and her children do very well. I really believe that they will. Their mom is very informed and has all of the resources. And very importantly, she's using this huge platform of RHOA to share awareness, because I know a lot of people hadn't heard of osteogenesis imperfecta before. Yeah. All right. So we'll keep on moving. And if anyone has any questions, if we have time real quickly in the end, we'll talk about them. But also, of course, this is the day of our members only live Q&A. It'll be right after this. There's a separate link for my members at the highest tier, and then we'll do live Q&A, and we'll talk about just about anything, whatever y'all want to talk about. All right. Oh, Shador.
Yes.
Shall we talk about Bishop T.D. Jakes?
Yes, we should.
Okay. So you remember, right, back when it happened, November 2024, we discussed it right here on this YouTube Live, that Bishop T.D. Jakes had a medical incident while he was preaching from the pulpit. He was, walking, talking, had his microphone, and then he sat down. His speech became really slow, and then he looked like he just kind of passed out or fell asleep. So, of course, everyone went, they rushed him out, took him to the hospital, and he shared that he had a medical incident. He did share that he did not have a stroke. And, and I had a short form content I did back then. If you scroll back to November 2024, you see where I talked about all of the possible causes of TD Jakes' medical incident. But now he's come out and he shared what happened to him. So let's roll that clip, and you'll see. I want to start it kind of right where he talks about the medical incident.
Mm-hmm.
It happened to you that morning on stage?
I didn't really realize what was happening to me on stage until I got to the hospital in an ambulance, and fussing that it happened on stage, by the way, because I didn't want it to happen. And the doctor leaned over in my ear and said, "You'd had a massive heart attack." Oh. And the reason I didn't realize it is because I had none of the symptoms that they say, no numbness, no sharp pain, no anything. I just kind of drifted off to sleep. I didn't know what it was, but I almost died.
Massive heart attack.
He said 5 minutes later, I'd have been dead on arrival. The right side of my heart had completely stopped getting blood at all. And as long as I was up preaching, I felt fine. But when I sat down, the adrenaline dropped. And it exposed the fact that I was preaching with half of my heart closed through a clot. And they had to go get it. And it was an amazing experience, man. It was just total, the whole experience, not just what they said.
Amazing. He had a massive heart attack, and Shador, he didn't have any chest pain, no arm pain, none of those classic symptoms. Everyone, please make sure, just pause for a moment. And be sure to give us a like, please, a like and a share on YouTube, on Instagram, on Facebook, in the replay. Give us a like and a share. It helps with the algorithm. It's a free way to support the channel. It lets them know we're here. We're here. Get used to it. And we're giving you evidence-based information, give you a fresh take you can't get anywhere else. So please go ahead and give us a like. And let's talk about TD Jakes. Now, let's see. We talked actually just last week right here on some of the atypical symptoms of a heart attack, because there was that 46-year-old female TikToker who only had right shoulder pain. That was it. She had some right shoulder pain, and she ended up having a heart attack. She didn't have chest pain. She didn't have the tingling or the numbness. And so I will run through, some of the atypical or unusual heart attack symptoms. But then what I want you all to share in the chat, what are some of the risk factors for having heart disease? What are some of the risk factors for having heart disease? All right, while y'all put that in the chat, let's just run through some of what we talked about last week. We know that we know the typical symptom is crushing chest pain, like an elephant sitting on your chest, and possibly the pain radiating to your left jaw, your left arm or shoulder. That's what we hear about, this classic. Bishop T.D. Jakes didn't have any of those, but some of the atypical or unusual symptoms, which very often occur in women. Okay, women will get abnormal symptoms, and diabetics. Diabetics will oftentimes have atypical symptoms. And so those might include fatigue, sleepiness, which really is all Bishop T.D. Jakes had. Also, you could have a tingling sensation in your arms, your shoulders, your back, your stomach, nausea and vomiting. Okay, you can have nausea, vomiting, and no chest pain at all. And that could be your warning symptom of having a heart attack. Also, breaking out into a cold sweat, having a cold sweat or diaphoresis could be a symptom. Having heart palpitations is another one, lightheadedness, dizziness. And so if indeed you are having what could be heart attack symptoms, especially if some of these start to combine themselves, and if you know you have risk factors, which we'll discuss next, don't try to be a hero. Don't just kind of be like, I'll wait and see. Go ahead and call 911. Definitely don't try to drive yourself to the hospital, because what happens if it really is a heart attack and then you pass out and then you're here flipped on the side of the road, you don't hurt yourself and you took the lives of other people. Please don't do that. And also, you might think that you can handle things quickly and have a loved one to drive you to the ER. That's not the best idea either, because if you call 911 and the ambulance comes, at least they can start care immediately. Okay. Right there on the ambulance, they can give you oxygen if you need it. They can give you blood thinners if you need it. They can go ahead and call the hospital and alert them to get the cardiac catheterization team together. That's what it sounds like. Bishop T.D. Jakes had a cardiac catheterization. We'll talk about that. They can go ahead and have the cardiologist on deck, the heart surgeons on deck. They can be waiting for you, ready for you. So call 911, even if you suspect that you have a heart attack, because we do know that heart disease is the #1 cause of death. One person dies from cardiovascular disease every 34 seconds. All right. Shador, did anyone share any of the risk factors for having heart disease?
Yes. So we have Patty. Hi, Patty. Patty says can be hereditary.
Family history. That's huge. Yes, you can have a family history, because, I'm sure many of you have heard of people who were in their 40s having a heart attack, and they exercise, they eat well, they're slim, and they still have a heart attack. And oftentimes you find out that their dad, their mom, their cousins had heart disease as well. So yeah, it can run in the family, especially if you have something called familial hypercholesterolemia. Like if you have a genetic predisposition to having high cholesterol that clogs your arteries. So that's a real good one. Yes, having a family history. That was good.
You actually took Carmen's answer. High cholesterol.
High cholesterol. That's right, Carmen. High cholesterol. And so after you finish watching this video, I do have a video on YouTube, how to unclog your arteries naturally, where I talk about how to lower cholesterol naturally. But yes, high cholesterol is a definite risk factor. And for those of you who are new to us here on the YouTube channel, on the Dr. Frita YouTube channel, we have over 845,000 subscribers. I thank you to everyone who's a subscriber. And if you're not a subscriber, come on and join the party. I'm telling you, I give you evidence-based information. I have a good time doing the videos, and these are videos you can share with your loved ones. I break things down in a way that's easy to understand. It helps you to advocate for yourself when you go in to see your doctors. And no, I don't just talk about kidney disease or high blood pressure. I talk about those a lot, but I also have videos on diabetes, on lupus, on COVID, on the flu, on cervical cancer, on colon cancer, on lung cancer, on dementia, you name it. I have hundreds of videos. Also on the YouTube channel, if you go to my playlist, I break things down where you have a playlist just with kidney disease topics, playlists with heart disease topics. And I have a playlist of my television appearances, and that's pretty fun. And I just, we have a new one up just today of one of my more recent television appearances. I told y'all I did one Saturday and I did one on Wednesday as well. Oh, and today, yeah, I put on all my social media platforms. I posted at least part 1 of a television appearance I did on the Portia show. I love going on that show. And on this one, I have 2 siblings. And in this one, the sister donated her kidney to her brother, and she surprised him. She went and did the whole workup behind his back because he said he didn't want to take their kidneys from them, the big brother. She went and got worked up, found out she was a match, and she went and let him know, look, it's done. I'm about to give you this kidney. And so it's a really great story. So check that out after you finish watching this live, me on the Portia show. All right, good deal. Anyone else give a risk factor for having heart disease?
Yes, Tisha. Tisha says high blood pressure, especially uncontrolled.
Woo! Tisha, you are telling no lies. That is a big one. Having high blood pressure is a huge risk factor for heart disease. It's also a risk factor for strokes. It's a risk factor for kidney disease. In fact, high blood pressure is the second leading cause of kidney failure. It's the second leading cause of me seeing people on dialysis. And one thing I do have, Tisha, I have a book. You can click the link in the description here, or you can go to my one-stop shop, drfrita.com, and I have a book, Under Pressure, A Guide to Controlling High Blood Pressure, where I talk about how to manage high blood pressure, not just with medicines, but I talk about a lot of lifestyle modifications, using food as medicine, exercise as medicine, meditation, slow, deep breathing, reducing stress, certain supplements. So make sure that, again, you can go to drfrita.com, the one-stop shop, click the link in my description. And I'm quite proud of the book. But yeah, that's another way to decrease high blood pressure, because yes, hypertension or high blood pressure is a risk factor for having a heart attack. Real good. Anyone else?
Shaquille, diabetes and obesity.
You got it. Diabetes is a huge risk factor. Okay. We're going to talk about diabetes some later on today, but it's a huge risk factor for heart disease and living with obesity 100%. Yes. Living with even being overweight and also having obesity. It's a risk factor for having a heart attack. Mm-hmm.
And Miss B Wellness, she said sedentary lifestyle and stress.
You got it. Yeah, I think y'all just about hit all the ones I was going to say. Very good. Yes, having a sedentary lifestyle, being a couch potato. Please don't be a couch potato. And we know that the American Heart Association recommends that most people exercise for at least 150 minutes a week of moderate exercise. Okay, so that's about 30 minutes of exercise 5 days a week, and that's a way to reduce this some of the risk factors of having a heart attack. And yes, having stress. When you are stressed out, that causes a surge in stress hormones like cortisol, adrenaline. And these hormones can cause your blood vessels to tighten. It can cause your heart arteries or your coronary arteries to tighten. So imagine if you already have high cholesterol, or if you have some type of a plaque, like an atherosclerotic plaque, causing a little bit of narrowing in your artery, and then you're running around here, you get stressed out, the squeezing of that heart artery could possibly squeeze on that plaque and cut off blood supply to your heart muscle, giving you a heart attack. So yes, stress is another risk factor for having a heart attack. Let me tell y'all something, med heads. Y'all are so sharp. I don't even know if I have any left. Does anyone have any left?
Yeah, Cheryl, she threw in high saturated fat and a high processed food diet.
Okay, yes. So then the diet. So if you have a diet that's high in saturated fats, certainly diets that are high in ultra processed foods, that's going to put you at risk for having clogged arteries, having inflammation in those arteries. So that's another great one. Real good. I love it.
All right. Thank me.
Any of the folks on IG or Facebook? I know we see the Facebook comments here. Yeah.
Yep. No chime-ins from there.
Okay. Good deal. Good deal. All right. So just make sure that you all consult with your physicians. So yeah, I think we covered most of them. Living with obesity is a risk factor for having a heart attack, having a sedentary lifestyle, diabetes, being high stressed, having high cholesterol, having a family history. And we hit on a lot of the main ones. Very good. Hypertension. All right. Right here on the YouTube channel, I have, if you look at my playlist, Dr. Frita, heart disease, Dr. Frita, heart attacks. I talk about all kinds of things. Warning signs of a heart attack. I talk about foods that will help you to avoid having a heart attack. I talk about causes of chest pain other than a heart attack. I have videos on all of these topics. So make sure you check those out after this live. All right. So let's move on to the next part of our weekly dose of medicine. And this one involves Damon Wayans, Shador. Y'all know Damon Wayans, the actor, the comedian. He's looking great. He's looking healthy. And he shared that he actually has a diagnosis of diabetes, and he shared some of his unconventional ways that he's treating it. Let's check that out, Shador.
All right.
So I never really got to tell you thank you, but I'm telling you thank you now. And brother, whatever you're doing, the regimen you're taking, you look beautiful, brother. Because you just told me your age. You just told me your age. I always thought that we were the same age, but you're a lot older than I, but you're looking good, brother. So whatever you're doing, I don't know if you're juicing, or if you're taking some facial creams or something, but you're looking good, brother.
No, it's
You're looking
I'll tell you
good,
what
my
I'm doing.
boy.
I'll tell you what I'm doing. I got diagnosed with diabetes about 10 years ago. And so I started growing fresh vegetables. I only eat my vegetables. I work out, lifting heavier weights, because that's what the scientists say really help you to to burn the sugar before you burn the fat. And I've not neutralized. What do you call it when you? I've gotten control over my diabetes, and I got the Freestyle Libre, so I know what food I can't eat or I shouldn't eat, and I just don't eat them. So it's good living, and I'm not out there whoring.
That's the key right there. That'll knock you down.
That'll make you old.
Okay, his last one, he says the key. If he's not out there doing that anymore, I guess that could cut back the stress. And we know stress can worsen your blood sugar. But yeah, he looks really good. He has the diagnosis of diabetes, and it sounds like he has it controlled. possibly controlled just by his lifestyle, which is actually pretty neat. And so when we talk about diabetes, and on this YouTube channel, I have a lot of videos on diabetes, on what it is, on foods that are good for diabetes, foods that you want to avoid. But just briefly, I will share that what diabetes is. We know there's a type 1 diabetes and a type 2 diabetes. And Shador, if you put up the graphic on the key model for me, please. So yes, so when you think about diabetes, we know that it's when you have hyperglycemia, or when your blood sugar is high in your blood, just like floating around in the blood, not necessarily in your cells. Well, every cell in your body needs sugar, okay? Every cell in your body needs sugar in order to survive and in order to function. In order for that sugar or glucose to get into your cells, you have to have insulin, okay? So insulin is like the key that unlocks the cell, and so that the sugar can get in. For people who have type 1 diabetes, which used to be called juvenile diabetes, they just don't have enough insulin, okay? Their pancreas doesn't make enough insulin. They don't have enough keys to unlock the cell, and so the sugar can't get in the cell. The sugar is outside of the cell. They have high blood sugar, hyperglycemia. For people who have type 2 diabetes, and by far, most people with diabetes have type 2 diabetes, well, they have plenty of insulin. They have high insulin in many cases. The problem is their insulin, their keys don't work, okay? So you got a bunch of keys that don't work. So guess what? The sugar still can't get inside of your cells, and so you have hyperglycemia. And so in managing type 1 diabetes, where you don't have enough insulin, of course, the treatment is going to be to give insulin. To manage type 2 diabetes, though, yes, sometimes insulin is necessary, but mainly you're trying to make it so that the cells are more sensitive to the insulin you have. You want to increase your insulin sensitivity. And ways to do that: one, to have a healthy body weight, especially having low abdominal obesity or trying to get rid of belly fat, because the more belly fat you have, then the more resistant your cells are to your insulin. And so with Damon Wayans, if he's exercising, staying at a healthy weight, that's going to help his body to respond to his own insulin. Also, the lifting weights, having high muscle mass is a way to help you with your insulin sensitivity. Yes, there are medications as well. We know of some of them, things like metformin, glipizide, glyburide, certainly other medications like the GLP-1 agonist, the Ozempic, the Mounjaro. And remember, originally these medicines were to treat diabetes mellitus type 2. They're very, very great at treating it, very successful in treating it. And so, but to Damon Wayans' point, even without medications, if you're able to get to a healthy weight, exercise, avoid the ultra processed foods, and eat the foods that are good for your diabetes. And again, I have a video here. I think it's 15 foods that are good for diabetes. And I talk about healthy proteins like egg whites, salmon, having healthy fats like avocados or olive oil, nuts, the healthy fats. I talk about eating cruciferous vegetables like cabbage, Brussels sprouts, cauliflower, broccoli. These things are all good for managing diabetes. Consult with your doctors and your registered dietitians, of course. Having antioxidants to get rid of inflammation, okay, and free radicals. So foods that are high in antioxidants include berries, okay, strawberries, blueberries, blackberries, things of that nature. And even in some cases, having some of the complex carbohydrates, such as sweet potatoes, squash, okay? All carbs aren't bad carbs. Certainly consult with your doctor and your dietitian to find out your carb count. But in some cases, it's okay to have these foods as well. And, having foods that are high in fiber, leafy green vegetables, there are ways to enhance your diet, your lifestyle, where you can manage diabetes naturally. Oh, yeah, I have another video here, how to lower blood sugar naturally. But always consult with your doctor. Don't listen to what I'm saying and say, I'm throwing away all of my medicine. No. Make sure that you consult with your doctor, but let your doctor know, hey, I'm really interested in trying to lower my blood sugar naturally, and they can help you to implement some of these things. And if you want to talk to me about it, I actually do have a service, a telehealth concierge service, where from anywhere in the world, you can talk to me one-on-one. Okay, we can set up a telehealth visit, and I take a full history, and we can talk about ways I can give you some information on your health in a more specific manner that way. All right. As we get ready to wrap this thing up, please make sure you remember to give us a like. And it's not too late to join the membership, because as soon as this is over, as soon as this Medical Monday that we're having right here is over, I'm going to give you a different link and you join me for a members only live Q&A. We're doing that immediately following here. And that's at the top tier link of the membership. And, you know, our memberships are very reasonably priced. We have more than one tier. At the least expensive tier, you get your own customized emojis, you get loyalty badges, you get special shout outs. It's fun. It still is a wonderful way to support us, and we appreciate you. We have another level where you also see my members only videos. Certain videos I release and no one ever sees them except for the members here on YouTube. And I also will give you first look at a lot of the videos that I do release. Like last week, I released a video on 7 natural ways to lower blood pressure without medicine. Y'all, I like that video. I'm sorry, y'all. I crack my own self up in the videos, and I honestly really do give good information. And speaking of cracking myself up, that's one of the ways you can lower your blood pressure naturally, by laughing out loud. That sounds bananas. It's the truth. When you laugh out loud, a genuine laughter, it causes your body to release nitric oxide. Nitric oxide causes your blood vessels to dilate, and that helps to lower your blood pressure. Isn't that a trip? Go ahead and laugh right now. Okay. All right, Shador. As we get ready to wrap up, let's do the 5-minute check-in, and then we'll close this thing out. We might take a couple of little quick comments at the end. Certainly, if you're a member and you want to throw in a comment or a question, or if you give us a super chat, we'll make sure we prioritize you, and then we'll slide on over to the members only live Q&A. So Shador, let's do this 5-minute health check. Y'all don't forget, hit that like, thumbs up, give us a like, give us a share. If you haven't subscribed to the YouTube channel already, please go ahead and do it, and click the notification bell so you'll be among the first to know when I release new videos. And please follow me on all social media platforms at Dr. Frita, and I give you the updates of when I'm going to be doing speaking engagements, community fairs, and certainly when I'm on television shows.
All right, Dr. Frita, I have a few to hit on today. Measles on the move. Amtrak on passenger.
Measles on the move. Let me tell y'all something right now. This is really scary because we know that measles is the most contagious virus that we know. If you are a person who is unvaccinated and you're exposed to someone with the measles, you have a 9 out of 10 chance of getting the measles. Okay. And even if a person with measles walks out of the room, the measles virus can stay alive for 2 hours. 2 hours after the infected person is gone. Well, there was someone who was on an Amtrak train. Okay, he came from Minnesota, went to Reagan International Airport in DC, and he was on the train visiting all kinds of stops. And now we know, sweet Lord, he has the measles. Okay. And so now, the health department very anxiously is trying to trace everyone, he's had contact with whom he's had contact. So just stay tuned for that story. If you were on the Amtrak train this past month, just go ahead and look it up and see if you were on the train with him. And especially if you're unvaccinated, you want to go in and talk to your doctor and see if, you possibly have the measles. And here's the good news. If you have had the MMR vaccine, if you've had 2 doses of it, you have a 97% chance of being protected. And of course, there's that 3% of people who can still get the measles. But if you have the 2 doses of the MMR vaccine, you have a 97% chance of being protected. And the immunization or the vaccination schedule that's recommended is that for children who are 1 year of age, 12 to 15, that's when the first dose of the MMR vaccine is recommended, and the second dose between ages 4 and 6. And if you're not sure, and if you've had the MMR vaccine years ago, and you're like, oh my gosh, there's an outbreak, it's getting higher and higher, then you can actually go into your doctor and ask them to test you to see if you're still immune to measles. Okay. One very important thing to understand is that we're having a measles outbreak, but it's not a run-of-the-mill one. We thought that we had eradicated the measles back in the year 2000, but it's back with a vengeance. And already, as of early March this year, we had already had more measles cases in the United States than we had in all of 2024. Okay. And as for our head of the HHS department, the head of the Human Health Services, RFK Jr., we know that historically he's someone who's shared misinformation about vaccines. That's documented. That's a fact. And one thing that he's putting out there is that vitamin A is a great treatment for measles. Do you know that we've had an increase in vitamin A toxicity since he's been putting that out there? So please don't run and start taking vitamin A, especially not under the supervision of a physician, because there's a such thing as vitamin A toxicity, and there's an uptick of it. The recommendation by the CDC and by scientists who practice medicine based on evidence, is that you get your MMR vaccine, 2 doses. Consult with your doctor, and please stick with medical sources that you trust. All right, what else we got?
Plastic in your Coke. Coca-Cola recalls 10,000 plus cans.
Now, y'all know I'm in Atlanta. That's like the home of Coca-Cola. All y'all AT aliens here love Coca-Cola. But yeah, Shador, there's been a recall of over 10,000 cans of Coca-Cola. That's like over 864 cases, 12 packs. And it's because they found plastic, or they believe they found plastic. So make sure that you are looking it up and look at your Coca-Cola cans if you have them, and see if you are among the people who they suspect might have plastics. And we talked about that story right here on YouTube Live, Shador, where it's been found that we have more microplastics in our brains. Okay, they did a study of people who had passed away, and they found that we have a significantly higher amount of microplastics in our brains, like the amount of a plastic spoon. That's what's in the brains that they found at autopsy. And they found that the brains of people with dementia, post-mortem, had significantly more microplastics than people who did not have dementia. Okay, they found that correlation. So yeah, just check it out. If you're a Coca-Cola drinker, I don't recommend the sugary sodas or ultra-processed foods, but I know y'all like Coca-Cola. But if so, just be careful and find out if yours is on recall for having plastic.
All right, last one, Dr. Frita.
Okay.
TikTok removes chubby filter. This filter makes you chubby.
I mean, Shador, this whole headline just sounds rude. Okay, so there was a chubby filter where people were making themselves look chubby with the filter, and really, in a lot of ways, kind of making fun of people who are living with being overweight or living with obesity. And they were doing it to like the song Anxiety by Dolce, and just body shaming, it would seem. And so now TikTok has removed that filter. And so just remember, a lot of people will see people who are living with being overweight or living with being obese, and they feel like it's living with obesity, and they feel like it's okay to pick on them, to laugh at them, and then troll them, but say, oh, I just want you to be healthy. Oh, I'm just worried about your health. And really, you're just being a troll, because in a lot of ways, it's the last acceptable form of discrimination. I don't like it. So if you're one of these folks who had that chubby filter, check yourself before you wreck yourself, and be kind. Okay, be kind. And if you are a person who's living with obesity, I am a board certified doctor in obesity medicine. Again, you can set up a concierge visit with me or consult your primary care doctor, because we definitely do have medical ways to support your weight loss. All right. Well, that's going to wrap us up, Shador. Do we have any little quick comments or things before we scoot over to our members only live?
Yes, this is pertaining to TD Jakes and his heart attack. Miss Marina, hello.
Hi, Miss Marina.
She says, is the heart attack he had the same as a widower maker?
Interesting. So when they talk about that widowmaker, they're usually talking about the LAD, the left anterior descending artery. In his description, what he shared with us was that it was a blockage on the right side of his heart. And so I'm imagining it was his right coronary artery. But either way, it was a pretty major artery, to the point where they told him had he waited 5 minutes, he wouldn't be here. So even though that's not the classic widowmaker, that left anterior descending artery, it sounds like his could have been a widowmaker just the same. That's a good question.
Very good. Ms. Rosalind, our member, asked, do you have any videos on migraine headaches?
Oh, Miss Rosalind, I do. Right here on YouTube, I have a video on headaches. I talk about migraine headaches. I talk about cluster headaches. I talk about just kind of the general run-of-the-mill headaches. I talk about tension headaches. I sure do. I'm telling you, I'll have hundreds of videos. All right, Ms. Rosalind, I'm going to see you in a little bit when we go over to our members only.
All right, and then shout out to our member, Miss Cynthia, just joined us not too long ago. She said,
hi there, Miss Cynthia. Welcome back.
She just commented on the Coke. She said, as a renal patient, I don't drink Coke because of the phosphorus.
You're right. Okay. Your kidneys typically, when you don't have any CKD, chronic kidney disease, will filter out phosphorus. But when the kidneys aren't filtering out phosphorus well, drinking these dark sodas like the Coca-Cola can give you high phosphorus, which can cause you not only to have a really uncomfortable itching in your skin, but can also lead to having a high PTH or parathyroid hormone, which can lead to having weak bones and all kinds of issues with your arteries. So very good, very good. But even for folks who don't have kidney disease, y'all know these dark sodas are not a good idea. Don't tell Coca-Cola I said that, but they have other products other than just the dark sodas as well. All right.
Thank you.
Thank you, Ms. Jador. Thank you to everyone for joining, for participating. I love when y'all answer the questions and when you play my little game, myth versus fact, and when you share your personal perspectives. And Anton, especially thank you to you for sharing what's going on with you and your son with the osteogenesis imperfecta. It just makes it real. And I hope it encourages people to go on, look, learn more about it. Again, I do have my short. You just kind of scroll through and you'll see where I'm talking about Real Housewives of Atlanta's Kelly Farrell and her sharing her story with the OI or brittle bone disease. But yeah, I appreciate y'all for being here. As we slide on out, please just make sure you give us that like and you share and, do all the things. And for anything that you're missing, go to drfrita.com. Someone had asked Damon Wayans if he's juicing. Go to drfrita.com. My favorite things. I have a juicer that I love to use, my Nama J2 juicer, and I have a discount code for you. And on my various platforms have different recipes for my juices. All right, let's slide on out the door and let's head to our members only live. Shador.
All right, sounds good.
All right, thank y'all.